Okay? Which side would you like? Okay, go that way. Alrighty, so already, I feel like I should give him a pillow, right? Yeah. Drop your head, drop it down, okay? Right? I should give him a pillow, right? But the fact is, I would have to give him a lot of pillows, right? And sink down into it, and he'll sink down into it. What I'm gonna do, drop your head, alrighty? Remember, how can you tell if somebody's actually dropping their head down? Yeah, full weight. My arm's gonna get tired after a while. Alright? So what you wanna make sure as best as possible, people with cervical issues or dysfunctions, a lot of the time, they are not gonna be in a neutral position, are they? Alrighty? So I'm gonna say as best as possible, try to align, drop it down. No, drop your head down. Relax your head down. Alright? I'm going to do as best as possible to see that his cervical spine is in line with his thoracic spine, which is in line with his trunk, the rest of the trunk. So can you just sort of lean forward just to drop in the trunk? Alrighty? You comfortable with the arm like that?
Yeah.
Put it in a position that you're comfortable in, okay? Alrighty?
Yeah.
Alrighty? Now, as long as you're comfortable, I'm going to proceed with the test. Alrighty? Because if they're not comfortable, they're not going to be doing what I want them to be doing, right? Alright, so as long as the arm position is not going to be in your way, say like he sticks his hand up more towards me, yeah, then I may say, okay, can you drop your hand back down a few degrees, right? Drop it, alright? Just relax. So I'm going to make sure that he's in nice alignment, okay? Back a little bit. There you go. Much better. Alrighty, now it is in line as best as I can because again, I'm looking at all the different joints, okay? Now what am I going to tell him to do? Yeah, can you bring your left ear to your shoulder? Right, and I'm going to let him go, okay? Now bring it back down, okay? Alrighty, now relax, I'm going to drop it in my hand. Now, small area, right? I'm going to put a finger or two, depending on, again, the size of your finger and the size of the person's neck, alrighty, right in the front, and I'm going to most likely have to slide it out of the way if he's going to complete the full range, alrighty. So on the count of 3, can you do that again? Alrighty, I'm going to see, right, and back down. Yes or no?
Is that for palpating?
Yep, just for palpating. I had my hands more on the sternocleidoid mastoid than the left scalenes. Alrighty. Look, in fact, I can palpate his scalenes. Okay. Everybody's here's his SCM. Alright, turn your head for a second. Turn your head the other way. Turn your head the other way. There it goes popping out. Okay. Alrighty, turn it back to neutral so I know where it is. Alrighty, so I'm gonna put my hand here. I want to do the scalenes. I'm just going to go posterior, slightly deeper. Does that feel a little bit deeper than this? See here? A little bit? Or no? Or you can't really tell? Okay. Alright, he can't really tell. So I'm just going to put my fingers. One on the SCM, not the whole thing, and one on your anterior scalene, because most likely that's the one you're going to be on. Drop it in my hand. Okay? Drop your head in my... Good. Now what I want you to do, on the count of 3, bring your left ear to your left shoulder again. 1, 2, 3. Good. Alrighty. And I could feel them coming into my hands. And I could feel them contracting. Because remember, if you want a muscle, if you want to palpate a muscle, whether it's just straightforward palpation or during a manual muscle test, you want them to do something. Right? Do whatever they do to make it come out, to make it a little bit easy on you. Alrighty. And also to help with the patient, to make them more comfortable. Alrighty. Okay. You okay? You getting tired? Okay.
No.
Alright, so, okay, now, okay, so what position, if I was going to put resistance on him, where would I do it? Drop your head. Where would I place my hand? Yeah, temple, right here, right sort of above the earlobe area, and again, is this a big muscle? Are these big muscles? No, alright? So again, be aware when you're out on the clinic, if your CI asks you to sort of resist that area, exactly how much resistance you're doing. It's a little guy, alrighty? maximal resistance here is so different from maximal resistance in your quadriceps muscle. You're not gonna be pushing him down, alrighty? Whatever motion he does, you're gonna resist it, alrighty? But you're gonna, again, same concept. You're gonna let him continue with, okay? Alrighty? What position would I have him for gravity eliminated? Supine. Can you go supine? You okay? You wanna rest a second?
No.
Usually with the cervical area, you do want to take your time and let him rest in between more so, because it is kind of hard holding the head up. Alrighty? Alrighty, so, a couple things that you may want to do when you're doing this, okay? Right? You're going to want to support, alrighty? Because you don't want that shearing thing going underneath. Alrighty? Now, if I support him underneath, lift up your head for 1 second. Am I placing him in some side flexion? Alright? So what you